Hey everybody, it's Dr. Randy. Got Paul in the office today. I wanted to shoot a video demonstrating our decompression table. Just one of the tools we use in the office to go along with adjusting and stretching and soft tissue to make sure our patients get the best care possible. This is a really good tool for low back and hip pain, especially disc pain. So as you can see, we got Paul all strapped in here. This table literally pulls apart at the level of his low back. Pulls for 30 seconds, relaxes for 10 seconds. So it creates a decompressive type therapy. Right now he's on the, we have it set for 150 pounds and 80 pounds, so it's gonna pull with 150 pounds of pressure at its max and 80 at its minimum. And again, that's gonna create that pulling apart or decompressive effect on his low back, which is so good for lumbar discs. So one of the most common things we see in the office is irritation of the discs in your low back, especially L5, S1, the discs that sits between your L5 vertebrae and your sacrum, or L4, L5, those lower vertebrae. Those vertebrae take a pounding and there's no vertebrae, there's no disc below it. So those last couple are usually the ones that degenerate the worst. So adjustments in soft tissue are really good for it, but doing some decompression to go along with it, we have found gets patients even better results, quicker, gets them out of low back pain much faster, because just like on this model, if the disc herniates, it's going to irritate the spinal nerve in that area, and that's going to give you the shooting leg pain, the weakness into the leg, the drop foot, all those really bad symptoms of a herniated disc. So before you maybe try shots or injections or just numbing the pain with medication, I would suggest if you come in, we can do an exam on you, and we can get you set up on this decompression table, and hopefully get some relief by taking some of the compressive nature out of that disc, allowing the middle of the disc to go back to where it should be. That takes the irritation off the nerve. It's just a really good stretch. Also good for hip pain. We set this therapy for like 10 to 15 minutes, and we typically do it after their adjustment. So patients have seemed to respond really well with it. So that's the decompression table we have in the office. If you're interested in getting this done, give us a call at the office. It's at our Irwin location. We can get you set up. Thanks, bye.